Rectus femoris muscle can easily be done seated. You bring the knee up like so. Stabilize the torso at the shoulders. Hold. Good. Bring this side up and hold. Good. Try that again. Hold there. Push, push. Good. So that's rectus femoris. We can also do the quadriceps as a group. We bring the leg up. Make sure your knee is at about 90, and you can push into my hand. Good. And then the same thing on this side. Push into my hand. Good. That's quads as a group. We can also test the piriformis in this position. I'm going to take your cushion out here for a second. The piriformis, we have the patient hold as we try to internally rotate the leg. Hold there, push, push. Also in the seated position, we can do a hamstring test. Hamstrings as a group, pull back. Good. Pull back. Good. You can rotate out and do the lateral hamstring and rotate more externally, do the medial hamstring. We'll do those, of course, supine and prone as well. Also in this position, patient can be tested for, actually, why don't you scoot back on the table with your legs on the table. We can do the rectus abdominis test, and I'm going to ask you to bring your arms like so, and I'll do it from this side. I'm going to brace her legs, make sure that her back is straight and that she's not flexed over this way. And I'm going to push across here, hold. Good. So that's the rectus as a group. This would be emphasizing the right rectus. This would be emphasizing the left rectus. And to be really precise, I would probably want to test that one from the same side. We can turn the torso this way and test the obliques as a group, the right external and the left internal. And that one, hold there. And I'm trying to take her from a left rotated position back towards neutral. Come back this way again. Once again, stabilizing at the legs and holding this way. So hold there. Good. So once again, seated position. Moving into the rectus abdominis and the abdominal oblique muscles. Could you scoot back for me to where your legs are straight? There's other ways to test this, but this is probably the most accurate way. Make sure the patient has his or her back straight. Go ahead and bring your arms in front. Make sure you have fists so you're not TLing. There you go. And you start with them in neutral. Brace the legs. Push into my hands. Hold. Good. Okay. Turn slightly to the left. This is going to emphasize the right rectus abdominis. Turn slightly to the left. That's going to emphasize the left. Turn to the right. It's going to emphasize the left rectus abdominis. Turn all the way to the left. This is going to activate the right external obliques and the left internal obliques. Brace here. Hold. Hold. And you might want to, it's hard to get really good contacts. Sometimes you can get a false positive if you're pushing on a wrist. So try to vary your contact, make sure you get a good, honest test, and that's pretty good. Now, we can do quadriceps, piriformis, and hamstrings, all with the patient seated. So we're going, oh, and rectus femoris. So we'll start with rectus femoris, come up like so. I like to stabilize over the torso, hold, good. And bring this side up, hold, good. That's one way to test the rectus femoris. We can test the quads as a group, just like we would with the patient supine. Push into my hand, good. And bring this up here. You want to keep the knee at 90. Push into my hand, push with your, there you go. Okay, push, good, those are good. Now the piriformis, you bring the hip into just slight external rotation, broad contact over the medial foot and ankle, stabilize at the knee, just above the knee, hold, good. And hold there again, good. And hold there again. This works very well for when we're doing procedures like plus. We can also, in this position, and we'll do this again supine, is test the tib anterior. Curl the toes down, hold, good. We can test the tib, the peroneus tertius, toes down, hold, good. We can test the peroneus longus and brevis, hold there, toes flared up slightly, if you can see that, and hold, good. And the tibialis posterior, full plantar flexion, full inversion, toes flared up slightly. I come around, my vector is scooping in and out like this. Hold there, good, down, 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 hold. Good, that's a good one. These get missed if you allow the ankle to dorsiflex. They will try to dorsiflex to gain, to gain access to other muscles. So to keep that test honest, they need to be in full plantar flexion and keep the toes up. That takes the flexor digitorum longus muscle out of the act. We can also test, while we're here, we'll go over these again, we can test the flexor hallucis brevis, hold there. This is, I'm stabilizing right here at the MP joint. And then we move up to the first phalangeal bone here, or phalangeal joint, hold there. And I test the flexor hallucis longus. Now with the patient supine, we are going to test the upper and lower extremity muscles the way we would test them supine. And we'll start with the lower extremity muscles. We're going to do the rectus femoris, which we did seated, but this is how we would do it supine. I like to have the knee extended just a little past 90. Hold. Good. I'm supporting here, my vector is here. Bring this side up and hold. Good. Rectus femoris. The quads as a group. We start here and we keep that 90-degree bend in the knee, bringing it down to here to our fulcrum. Push into my hand. Good. Let it go. Hold there. Okay, I'm doing the two different kinds of tests. There we go. You can do the other side from here. Push, push. Make sure your vector is square and not here. Your testing arm. Good. So quads as a group. The psoas muscle, 30 degrees out, 30 degrees up. Stabilize the opposite pelvis. I like to use a broad contact over the ankle. Heel, push up, push, push, and that's a good one. 30 degrees out, 30 degrees up, hold, and that's a good one. And if I did that even more precisely, I would be on the same side as the muscle. Hold there, push up, good. Iliacus is basically the same test, except you don't do 30 degrees abduction. It's just 30 degrees flexion with full external rotation of the hip. I forgot to mention that with the psoas as well. Full external rotation at the hip, 30 degrees flexion, no abduction, stabilize, push up, and that's the iliacus. And if you remember from session, push, 2 or 3, ileocecal valve, often there'll be a weak iliacus on the right side. Now, we're going to do the gluteus medius test with the patient on their side. Would you lay on your left side, please? So you have them lay on their left side. You take the underside leg and you bend it a bit so they have a nice stable base to work from. Make sure they're holding onto the table and they can feel themselves positioned this way. Make sure their shoulders are square. When you test the muscle, the key thing is to keep their pelvis from doing this. What will happen is they'll flex their hip, and that will throw the test off. So we want to have you hold just like that, and I'll hold her there. Push into my hand. Good. And push into my hand. And that's the test right there. Hold, push, push, push. Good. And that's actually not too bad. They're weak in this position more often than they're strong. Now, while we're here, we can do the other side's general adductor test. We bring the leg into the testing position, and I've got my knee here. Now you can try to keep yourself. There you go. And I'm going to bring my arm around, hold this leg up this way. We bring the underside leg up, see if they can hold that. Hold there, push into my hand. And that's actually not too bad. That's pretty good. And so you can test the gluteus medius with them supine. It's not quite as accurate. You'll never miss them this way. Go ahead and lay on your back again for me. We're going to move up to the upper extremities, the way we would test them in supine. This is going to be the pectoralis major clavicular. Hold your elbow straight. Hold. Now, if Jane let go, if that muscle was weak, we would get this kind of effect. Other side, I can test from here. Hold. Hold. If I'm never sure, or if I'm ever not sure, good, that's it. When I'm testing from one side, both muscles, I'll go over and test it on the same side to make sure I'm not missing anything. The pectoralis major sternal, we test very much in line with the fibers. The fibers run this way. They're going to push towards the opposite hip. Hold. Good. And hold. Good. Ooh, that's a nice push, push. That one's really good. Push, push. That one's pretty good. The pectoralis minor, we tested it seated earlier. Hold there. I'm going to stabilize here. Hold. Hold. Okay. Hold. Good. And we can test the cervical flexors in this position. Bring your arms into this position. I'm going to have you bring your head into this position. We're going to test the scalenes as a group. Hold. And I don't need a lot of pressure here to test those. Turn to the right and get the left scalenes. And we can also test SCM. Hold. And sometimes it's helpful to test them in this position too, because it can be different than seated or standing. We can also test the teres minor in this position and the subscapularis in the supine position. I often do that. We can test the supraspinatus in this position, the infraspinatus. Hold. Hold, hold, hold. Good. We can test the latissimus dorsi, full internal rotation. Hold. Full internal rotation. Hold. Good. And last but not least, the tensor fascia lata. I like to stand at the patient's feet, push up and out for me. We're about 30 out, fully internally rotated, and 30 up. That's a good one. 30 out, full internal rotation, 30 up, hold. And your vector is, go ahead and let it go, Jane. The vector is sort of like that. The supine gluteus medius test is going to be with the thigh abducted, and you want to extend the thigh to where the foot is just slightly below the table. Your vector will be from lateral to medial and slightly from I to S in this position. Good. And same thing here, push out and hold. This test is pretty good as a screen, but you will miss a lot of them. You'll miss a lot of the more subtle weaknesses. The same with the adductors. You can test the adductors as a group this way, hold, and it's a nice screen, but once again, the other test, you'll never miss them. The sartorius, knee comes up and out, do okay, hold that right there. You want this, the patient's heel to be right about mid-shin to start with. Cup the ankle, hold there, hold, hold, hold. As soon as you feel the patient, hold, engage, hold, hold, then you can challenge the muscle. You don't ever want to take a run at this one, or actually any of them. Hold, but that's pretty good. Gracilis, we bring the leg we're not testing, we bring the leg we're testing towards midline with internal rotation, and we stabilize the opposite leg, hold, and that's pretty good. Hold that right there, hold, good. So that's the gracilis, so sartorius and gracilis. We can test the hamstrings in this position, hold there, hold. The knee is at 90, I'm pulling straight back this way, hold, hold, good. And if we emphasize the lateral, we internally rotate the hip just a little bit, hold, good. We externally rotate the hip a little bit, and we can emphasize more the medial hamstrings. Not my favorite way to test them, but you can test them that way. You can test the feet. We already did that, didn't we?
When I was seated at the end of the table. The toes? You're talking about the toes?
Yes. We can do the feet in the supine position, of course. And a lot of times, go ahead and scoot down just a little bit. It's nice to bring the feet just a little off the table, come down a little more if you would. So, and often we can take one leg clear out of the picture here. If we're going to test the tib anterior, we want to dorsiflex. Remember, there's 4 ways the ankle can go. Plantar flex, dorsiflex, inversion, eversion. So these muscles we're testing will be doing one of those actions. So the ankle comes into flexion, we curl the toes down, I come in above, hold, that's the tib anterior. We bring the foot out into eversion, curl the toes down, dorsiflexion and eversion, and let your hip relax, there you go, and hold, and that's peroneus tertius. Drop the foot down and into eversion, flare the toes up slightly, and see my vector here, hold. That's peroneus longus and brevis, hold, good. We bring the foot into plantar flexion and inversion with the toes flared up slightly, and hold. And that's tibialis posterior. The way we test the gastroc soleus group in this position, the way I like to test it, plantar flex, hold, and I'm going to pull on the calcaneus, trying to bring it this way. Now, if the hamstrings are dysfunctional somehow, you'll get a positive test often. You want to test the hamstrings first and then clear any weaknesses that you find, and then you can go back and test it this way. Hold. And that seems to be pretty good. Now, hamstrings, we're not going to pull on the calcaneus, and that way we're going to be testing with the foot more in neutral, with our testing hand above, slightly above the ankle. Now we have the patient in the prone position. We are going to test all of the muscles that we can access from this position. And we're going to start up here at the head and neck, mid-back, and move our way down. So seated and, well, seated, mainly seated, and you can also do the standing, we tested the neck extensors as a group. Now, a lot of times we'll have the patients kind of engage the shoulders a little bit and then bring the head up this way. Now I'm once again going to brace in front, hold, and that's pretty good. Now another way to do that is to have the arms in this position here. And this is going to, if you think that, go ahead and come up this way, and hold there, good. And sometimes it's helpful to have, if you think it's going to be weak, you want to have your hand there so their head doesn't, go too far. Go ahead and relax them again. So neck extensors prone. Of course, we can do neck and come up this way again. Turn to the right, arms into position. We can do hold. Good. The right side and hold. Left side, hold there. And that's pretty good. Good. Go on down. So neck extensors. Now, I really like doing the middle and lower trap in the prone position. We bring the arm into abduction, external rotation. Patient turns to look towards the side we're testing, like so. And you can rest your head down. There you go. Now, you have a lot of leverage, so just very gentle hold. Hold for me. Hold. And I'm feeling for scapular motion there. Go to the other side. Bring this arm out. Thumb up. External rotation. And good. And feeling for scapular motion. Good. Hold. Hold there. That's not bad. Not too bad. You'll find these weak as often as you find them strong. Hold that right there. Look towards the arm again. For the lower trapezius, I'm going to be pushing in this arc here. Hold. Good. Hold there again. Good. Now, a lot of times you'll get arm adductors playing the role here. So the vector is pretty important. You want to actually feel these fibers working. Now, some people also like to test this from the head of the table. I think that works pretty well too. Turn to the right and bring your arm up this way. What's nice about this is you can get a little more control, I think. Now hold that right there over your vector. Good, and that's good. Okay, that's middle and lower trapezius. Now you can also test the lat in this position. The latissimus dorsi, hold there. And elbow straight. So you're pulling out and slightly anterior. It's a little awkward, but it's doable. So hold there. See, my vector's sort of like this. That's very good. Okay, cool. The erector spinae as a group, bring your arms back this way, and you're going to bring your right shoulder up and turn this way. I'm going to be pressing on her scapula, bracing her legs, and hold. Good. And hold. Good. And that's very good. Now I'll go to the other side. As a tester, you don't have a ton of leverage. Hold there. Hold. That's pretty good. Very good. Okay. So that's a rector spine A as a group. Moving down into the glutes, and we tested the piriformis seated. We tested it supine. Now we're going to test it prone. It's different because now the thigh is in neutral and it's not flexed. We want to bring the thigh out 5 to 10 degrees. A lot of people like to put their knee on the edge of the table just to kind of make sure that the patient's knee stays put. We want to bring the thigh into full external rotation. And she's very flexible, so this goes all the way over like so. Some people will go about to there, where some people are like that. So wherever their full external rotation is, that's what you're looking for. I'm going to brace her opposite thigh, pull into my hand. Sometimes this is an awkward test. Patients aren't used to using this muscle in this way. Hold there. See, she's using her quads a little bit. Hold. That's not too bad, but she's using her quads a little bit, so that's it. Now the same thing on this side. A little bit of abduction of the thigh. Hold there. Hold. Hold. Good. And that one definitely is crisper. So now hamstrings, and we'll go back to the glute max in a second, but hamstrings, we want to test. Now, I like to test them at about 45 degrees from straight. And then also I'll test them at a full 90, just depending on what I'm looking for. But usually starting at about a 45 degree position is a nice screen. So hold there. I make sure your elbow is straight, your testing elbow. Broad contact for stabilization. Push into my hand. Good. Now remember, a lot of folks, these muscles are very strong. And so you're using your arm to test them. Once again, hold. Good. Hold. And so you want to make sure you're not trying to use your triceps to test their hamstring muscles. Now moving into the gluteus maximus, one of my favorite muscles to test because it's just so, it's like the psoas, it's such a huge player. I want the patient's knee at 90 degrees or maybe even slightly more of a bend than 90. If you have the knee slightly extended, they can recruit the hamstrings and you might miss some underlying weaknesses. So we bring that knee up, keep that knee bent, hold that right there, and you stabilize the pelvis. Now, the way you can tell you've got them into full extension is you go up and then pretty soon their whole torso starts to twist. So you want to go just short of that. Hold that right there. I'm stabilizing here. Push into my hand. And that's pretty good. Now, some people will use like a broad fist contact. That can work. You want to be real careful pushing into all these muscles because you might trigger false positive. Same with this side here, coming up this way, and hold. Now, if you watch, now go ahead, Jane, try to straighten your knee as I test this. Hold. Yeah, a lot of times that's what the patient will do. They'll straighten that knee. Try that again. And sometimes you've got to keep the knee bent this way. Push up and kind of hold it with your shoulder. I've had to do that before. So we've got the hamstrings, gluteus maximus, piriformis. There is a prone iliacus test that I use sometimes, and that's where you bring the knee into 90. You internally rotate the femur, and you pull towards you. Hold there. And that's used by some AK docs as a prone iliacus test. And hold, hold. And it will often test a little shaky. And sometimes it's a good test to use.